we have some information to share with you regarding Indiana Medicaid's upcoming cost share requirements. As of May 2024, the Indiana Family and Social Services Administration, or the FSSA, which you'll hear us refer to it as, reported that 1,977,147 individuals were enrolled into an Indiana health coverage program or an Indiana Medicaid program. So this roughly equates to about 30% of the total Hoosier population. This also means that the topic today, while it might not apply to you directly, the odds are that you have a family member or a friend or a coworker, or you encounter people at work in your daily life and in your daily routines that would benefit from the information. So it's my pleasure today to present to you to introduce to you my colleague, Shelby Hofmann. She is a program coordinator at the IRHA, and she serves on the Connecting Kids to Coverage Indiana team. Our team of navigators, which Shelby is an Indiana certified licensed health insurance navigator, is completely funded by the Center for Medicaid and Medicare Services. And in turn, we are able to offer free health coverage consumer assistance as a part of the IRHA services. A little bit more about our program, Connecting Kids to Coverage. We are a second term grantee. We were awarded the funding in the first round in July of 2019, and we're proud and happy to continue the program throughout 2025 with the current funding. And we hope to be around for a long time to serve families statewide. Shelby, I'm going to go ahead and turn it over to you. Before I do, I'm just going to kind of highlight the learning objectives for the day. Shelby's going to break down what is cost sharing, when will cost sharing return, who is affected by the return of cost sharing, and what are the best practices to prepare for and manage that return of cost sharing. So Shelby, it's my honor to turn over the mic to you and learn more.
Thank you so much, Ann, and thank you everyone for joining for the Lunch and Learn today. As Ann mentioned, cost share returning is starting July 1st, so it's right around the corner. You might be wondering, what is cost sharing? And cost sharing involves certain Medicaid members paying a small portion of their costs to maintain their health coverage. Cost sharing is not something that's new. It's something that was suspended for 4 years due to COVID-19 public health emergency. During that 4 years, the only way clients and members would lose their coverage is if they voluntarily withdrew or if they moved to another state and were no longer in Indiana. A few of the elements that make up cost sharing, those consist of copays, premiums, personal wellness and responsibility account contributions, also known as the power account contribution. A copay is amount that members pay out of pocket for prescription and medical services, in addition to what is paid for by their health plan. A premium is a scheduled payment for health insurance, and the power account is a special savings for HIP Plus members. All HIP Plus members have one, and they pay the first $2,500 of their healthcare cost. Indiana covers most of that portion, about $2,500. So members pay between $1 to $20 a month for their monthly contribution for their HIP Plus. And that $1 to $20 depends, by family, because that's based off all of the household size and the amount of income coming in that household. The Indiana Medicaid members and programs that are expected to pay during this return are your HIP Plus members, your Hoosier HealthWise Package C members, and your MedWorks. HIP Plus consists of eligible non-disabled individuals age 19 to 64. The Package C is any eligible non-disabled children ages 0 to 18. and MedWorks is the eligible working individuals with a disability. And here we're going to talk about the cost of some of the requirements by the program. As you can see, the Healthy Indiana plan, their copays will range from $4 to $75. The monthly power account contributions, like I said in the previous slide, will range from $1 to $20, and that's all based off the income and the family household size. CHIP copays will range from $3 to $10, and the monthly premiums will be $22 to $70, and that again is all based off the income and family size. And MedWorks is the monthly premium range from $48 to $254, and that's all based off the income and if they're married and if both members are on MedWorks. Copay specifically applies to HIP Basic members and CHIP members. The only other HIP members that this applies to is HIP Plus members, and that's only in one specific case, and that's if those clients or members go to the ER for a non-emergent visit, they do have to pay the $8 copay. But for the HIP Basic and CHIP members, most of those copays are under $10. And outside of that, copayments are not required for any other Indiana health coverage program. Power account contributions are starting back July 1st, and we're wondering how they're going to affect new applicants. So if we meet a new applicant, the first thing they're going to want to do is apply for health coverage. Let's say that application gets approved. They're going to fall into what's called conditionally approved. That's where they're determined that they're eligible, but their benefits aren't active until they make their first contribution or their first monthly payment, which is from the $1 to $20. They have 60 days to make that first payment. There is an option that they could choose during the application that's a fast track, but we discourage from doing fast track payments. But once they get the conditionally approved, they have 60 days to make that first payment. Once they make, or if they fail to make that payment during the 60 days, they are looking at either terminated benefits or limited benefits. And that again is all based off the income that's in the household. So if they're under the 100% federal poverty level FPL, they'll be in HIP Basic. If they're over that income of 100% FPL, they'll be disenrolled and will no longer have coverage. There's some requirements that we want members to do starting July 1st. The first one is to apply, and then our goal is to enroll and then help manage. We want to enroll applicants or apply for applicants. The way they can do that is first by submitting an application. During the application process, applicants can choose their health plan, whether it be Anthem, MDYs, CareSource, or MHS. If they don't choose one of those, they'll automatically be enrolled into an MCE. The next thing we'll want to do is help enroll them. So the application's been submitted, it's been approved, and now the members are going to receive an invoice from their health plan, whether it's one that they chose or one that they were auto-enrolled into. The invoices must be paid by the due date for their coverage to begin. The coverage will begin the first day of the month that they make their payment. And then once they have enrolled and made their payments, now they're active. Our goal is for members to continue to make their payment whenever they receive their monthly invoices. If they don't make those payments within the 60 days, they are looking at the terminated or limited benefits again. And we talked about new members, but now we want to talk about active HIP members. How is this going to affect the current members? Right now, those current members should be receiving invoices through the mail. If they fail to make those payments, they are looking at the limited benefits or the termination of benefits. If they do receive the termination of their benefits, there is no lockout period, which is great for them because we could just start the application process all over again. There's no, like I said, there's no lockout period for that. I know we keep talking a lot about HIP Plus and HIP Basic, and I just wanted to touch base a little bit more about what the difference between those two. HIP Plus is the preferred program. The reason why it's the preferred is because it's the best value for the members. It covers essential benefits, as well as dental and vision and chiropractic, and there are a couple other services available, and we have a detailed slide that you can see all of the the benefits that are covered. But with the HIP Plus, they do have that power account contribution, and they do need to make that payment. On this next slide, you will see the breakdown of the monthly contribution based off the FPL and the number of people in the household and the income. And they range from $1 to $20. And you can see that a little bit right there. And HIP Basic, this is what they will fall into if they don't make that contribution. And if they're less than the 100% of the federal poverty level. The dental and vision and chiropractic are not included. It's just essential benefits. And with that, they have copays. So now they're having extra services for doctor visits, prescription, hospital stays. And even though HIP Basic sounds less than Plus, they're actually going to pay more. So HIP Basic members tend to pay more than what a HIP Plus member would. And you can see these copays of what the services would be. So for non-preferred drugs, they're looking at $8. Sometimes inpatient stays they're $75. So you can see how the cost would, add up to over $20 a month. And this is just a summary of why our HIP Plus and Power account, why it's preferred, the best value. And I mentioned that there were other benefits that HIP Plus included. And this is a detail of the dental, vision, chiropractic, and etc. We have the power account contribution and the purpose of it. So just a little bit of a summary of what I've said from the previous two slides. And the other power account returning affects Hoosier HealthWise Package C members. Those are our CHIP members. For established members who already have CHIP, they can't be disenrolled if they don't make their payment. So they'll have coverage for 12 months. However, all members have to redetermine their status. So when they go to renew, they could potentially be disenrolled during that time. One, if they're not eligible, and two, if they have any previous missed payments. If the members are disenrolled during that period at the renewal for a missed payment, they must catch up on all their missed payments, or they'll serve a 90-day lockout period. New applicants, will submit the application, and once they're approved, they'll fall into the conditionally approved, which means they're eligible, but they're not active until they make that copay. And they'll have 60 days to make that payment. Their coverage will be active the first day of the month the application was submitted, and there's no retroactive coverage. So it just starts the first day that the month of the payment was made, or the application was submitted. I'm sorry. The coverage will begin active the first day of the month the application was submitted. And I say that it's specific to Package C because there are two different packages with Hoosier HealthWise. We have our Package A and our Package C. The Package A is for children and pregnant individuals that have no cost sharing. And then the Package C is the full service plan for children enrolled into the CHIP. And they do have that small monthly fee of the premium and copay for their services based off the income. The power accounts affecting MedWorks. This is another category that I mentioned before. For new applicants, people that are at income or above 100% of the FPL will be conditionally approved. Again, that's where they're eligible but not active until they make their first payment. They have 60 days to make that payment. Once that payment's made, their coverage will be active 3 months prior to when the application was submitted. For anyone that's disenrolled for non-payment, they can reapply, but it's important that we share that they have to get caught up on their payments because if they don't, they could potentially serve a 2-year lockout period for those families over or above the 100% FPL before their coverage can be reactivated. With payments resuming, established members are already receiving those invoices, and new applicants just need to make their first payment for their coverage to be active. And we're wondering, where can these members make their payments? For people that have HIP, and for members who have HIP already, they can make their payment to their health plan, whether that be Anthem, CareSource, MDWise, or MHS. And for our CHIP and MedWork members, they're going to make their payment to the premium vendors, which is MedWorks or Hoosier Healthwise. How are these members being notified of these payments that they need to make? Notices have been going out from FSSA for the past 60 days. The managed care entities, the MCEs, have been sending postcards 30 days prior. Invoices are being sent before the first payment is due. And if clients and members are not receiving that information, we can always direct them to the portal because their benefits portal will have this information as well. If they're failure to make those payments, the benefits might be reduced or terminated. I know I keep touching on that, but it's just important that we guide and direct and educate these members that how important it is to make their payments. You know, they do have that 60-day grace period. HIP Plus members, if they fail to make that payment, will fall back to HIP Basic, and they'll have that copay required, which will be much more expensive for them. And the first closure for non-payment will occur October 1st of 2024. And how can we help Hoosiers? We really want to help Hoosiers maintain their coverage. We can do that by educating them. We can also share awareness. And as I mentioned, we can always share them the information to go back to the portal. That way they can log in and specifically see, you know, where they need to make their payment. And if those don't work, you can always refer them to the CKC team. We do have appointment options. We can meet virtually, in person, or we can even do a hybrid. Whichever works best for client. It varies case by case. Also, we have our Get Help, Give Help. The Get Help is a great way if you yourself need assistance. You can use this QR code here and schedule an appointment with our team. If you're working for an agency and you have several clients that you want to refer to us, you can select the Give Help and schedule appointments directly. We're always available by phone call. You can visit us at our website, or you can also email us. We also,
Shelby, there is a question in the Q&A.
Oh, I'm sorry.
No, nothing to apologize for. I just wanted to let you know, will a client receive a letter if they switch to HIP Basic?
Yes, they will receive notification from FSSA.
Thank you.
You're welcome. We also have our Facebook page and our Instagram page. We love to share our activities that we do within the community. So you can always find us on there too if you're needing assistance in any way or just want to see what the team is up to. Even though we help specifically with health insurance, we do have our IRHA help, which is a great tool that IRHA offers. It offers a bunch of resources. So if there's anyone that needs transportation or food, you can use that QR code and use the site to help locate some extra resources. Thank you for listening. Does anyone have any questions?
I don't have any other questions in the Q&A or the chat at this time, but certainly if anybody wants to submit one, please do that now, or you can again use the raise hand function and we can allow you to unmute your line to ask that question verbally. But first of all, Shelby and Ann, thank you so much. A lot of information in that presentation. And somebody asked, will these slides be emailed? Yes, we absolutely can do that. You'll just need to provide us with your email address that you'd like to receive them, and we get them out to you. You can do that again in either the Q&A or the chat function.
Thank you, Shelby. Just one quick question for you, Shelby, just for clarity. I know you refer to CHIP quite often. Can you remind the audience what CHIP stands for?
Yes, I apologize for not explaining that and using that acronym so often, but CHIP refers to the Children of the Healthy Indiana Plan through Hoosier Healthwise.
Or the Children's Health Insurance Program?
Package C.
Okay, fantastic. And then one quick thing too, is you were going through your slides, I noticed you have great links in those slides. For instance, on the make a payment or how to make a payment, I noticed there's a link in there that has contact information for individuals to contact their managed care entities or that premium vendor. So happy to hear from Allie that those slides are going to be shared, because there's a wealth of information. You did a great job covering a lot of territory in a very organized way to get through that. So thank you very much, Shelby.
Thank you.
Seeing any questions come in, I'm seeing some email addresses, so we'll definitely get the slides out. We may wait until we have the video posted, so you'll get a link to this presentation as well as a copy of the slides. You can refer back to both, but we will get those to you as soon as possible. I see 3 of you have shared your contact information. We'll give it just another second here to see if any more questions come in. But again, thank you everybody for your time today. We so appreciate it, and we so appreciate the information you've brought to us today.
Thank you, Allie. It was our pleasure. Thank you for having us.